Facing any medical procedure can bring up a lot of questions and sometimes a little worry, especially when it involves something as important as a biopsy. You might be wondering, is a vacuum-assisted biopsy, or VAB, a safe choice? The good news is that vacuum-assisted biopsy, often called VAB, is generally considered a very safe and effective procedure with a high success rate. It is a minimally invasive way to get a tissue sample for accurate diagnosis. However, like almost any medical procedure, it does come with a small set of potential risks that are important to understand. These potential risks arise because the procedure involves inserting a small needle into the breast tissue to collect samples. The most common and usually mild risks include some temporary bruising and soreness around the biopsy site, which is very normal after any needle procedure. Occasionally, you might experience some bleeding or a small collection of blood under the skin, known as a hematoma, which typically resolves on its own. Infection is a very rare but possible risk, as is any time the skin barrier is broken, though sterile techniques are always used to minimize this. To help minimize these potential risks, it is important to follow all pre- and post-procedure instructions from your healthcare team. This might include avoiding certain medications, like blood thinners, before the biopsy to reduce bleeding. After the procedure, keeping the biopsy site clean and dry, and applying gentle pressure or ice packs as instructed can greatly aid in your comfort and recovery. Do not hesitate to report any unusual pain, swelling, or signs of infection to your doctor. A key advantage of the vacuum-assisted biopsy, especially compared to some traditional surgical biopsies, is its precision and effectiveness in obtaining multiple samples through a single, small incision. This greatly reduces the need for repeated needle insertions and minimizes scar tissue formation. It also allows for more comprehensive tissue analysis, improving diagnostic accuracy, which is a significant value proposition. Ultimately, the goal of a vacuum-assisted biopsy is to provide you and your doctor with the clearest possible information for your health journey, with risks that are well managed and typically minor. By understanding these potential considerations and working closely with your healthcare team, you can approach your biopsy with confidence, knowing you are making an informed decision about your care.